Thank you for joining us. I'm Anon2 World, and I'm joined by.
I'm Discordian. Hello, welcome everyone. We're going to talk about COVID-19. This is our second stream. What did you want to talk about today?
whatever you want to talk about. Actually, we have a lot to kind of cover here. There's a lot of different topics we want to talk about. Um, there's the cases that seem to be leveling off in some instances, like you were just talking about off air. I'm scrolling up to get to the cases, but we also have a stupid ad that's blocking us here, so I have to get rid of it. And of course, it's still not getting rid of. But the main point is what we're seeing here is these numbers. So go ahead if you want to talk about that. We're looking at the daily new cases.
Yeah, so when you look at the daily new cases, you see that there is a slight leveling off. What you expect is that it goes exponentially up, but instead it's going steadily. We had roughly the same amount of cases for a few days in a row. So that means our social distancing measures are working, that we are slowing the virus down.
Yes.
That's a good thing, but also we have to be cautious because once you stop doing that, cases will go up again, like you see in the beginning.
Well, I mean, this virus is so contagious that we're going to have to um, change the way we kind of interact for a while, right? I mean, you're not going to want to go to the grocery store just to go to the grocery store, like we used to. You go to the grocery store only in an emergency at the moment. At least that's me, you know.
Yeah, well, for me, it's
Oh,
kind
so
of different
yeah.
because I'm an essential worker, so I
Well,
go to the grocery store every day.
I hear you. I go to the grocery store every once in a great while, but I'm also an essential worker too. Unfortunately, that we have to be these essential people. I guess it's not unfortunate. I guess
No,
we're
we are
helping
doing this for the people, you know.
for the people.
Anyway, what do you think about all the crazy conspiracy theories going on?
I
What's the most absurd one?
I think the most absurd one that I've heard is 5G causing coronavirus. People don't obviously understand the way different frequencies work, and higher frequencies, lower frequencies, um, different effects they have on biological life and stuff like that. It doesn't
Yeah,
cause
well,
viruses.
first of all, doesn't cause viruses, and 5G radiation is like 60 times below the hazardous range. Um, what people also don't seem to get is that viruses spread through humans to humans, not through 5G towers. So you don't only see spread in countries where there is 5G, you
What's
know?
up? Well, yeah, I gotta say you're 100% right. Hey, Primitive, what's up, bro? Miss you, man. Wish you were here. But no, you're 100% right, dude. I got into an argument with the conspiracy anon dude. He's constantly broadcasting conspiracies out, which is fine. I mean, I have nothing against him, but it could be dangerous.
Oh yes, absolutely. Because people will think, oh, it's the cell phone companies doing this. They're killing off their own subscribers. I still don't see the reasoning behind it. And if powerful people want to kill people, they would do it in a way that it doesn't affect them, you
Well,
know?
their whole thing is this weird Illuminati kind of turning the frogs gay with the water stuff, Alex Jones type
Yeah, but still, that doesn't explain.
I mean, here's the thing. How long has this plan been in place to do all of this? And, somebody, Black Dream Hunk 2. What's up, Black Dream Hunk 2? He says COVID 19 a bioweapon, and he's questioning it. I mean, I'm not gonna say no, but I'm not gonna say yes either because
I, I'm gonna
there's
I'm gonna say no. It's very ineffective for being a bioweapon.
yeah, I mean that's a good point. Bioweapons would probably kill off populations faster.
Yeah, and you know, if it was a bioweapon, countries wouldn't do everything to stop the virus. You know,
Prim
they're slowing down their own economy.
Primitive says Epstein didn't kill himself.
That's also very true, but
So
that's a different
you're
topic.
right. That's a different type of conspiracy. But the thing is there's logical conspiracies and then there's illogical
Hmm.
conspiracies. Okay, so when all of a sudden all of the cameras stop operating in a jail and suddenly the dude's dead and the guards don't know what happened because the guard took a break or whatever for 5 minutes and came back and he's dead.
Yeah,
Yeah, you got to
you're gonna
kind of
start questioning the
yeah
official
question it.
story. Yeah.
But okay, so you have a biological research facility, I don't know what, 20 miles east of Wuhan or something, or just directly south of Wuhan. Um, could it be a possibility that this leaked out because they were researching um, COVID type viruses? Absolutely. But
Yes,
is it a
but
bioweapon? No.
no, I think they are researching viruses, and SARS has escaped from bioweapons. Bioweapons, biolabs before.
Bioweapons
Um,
labs. No.
so it's not unthinkable because it's like a few kilometers away from where the outbreak started,
Yeah. I
or
mean,
even a few meters.
that's a logical assumption. It's an assumption. It's not necessarily a conspiracy because a conspiracy is an attempt. It's like an attempt to conspire against someone. You know what I can't find the proper English words because
And what this biolab was doing, they were researching coronaviruses, including bat coronaviruses like SARS and derivatives from SARS. So, it's not unthinkable that something could have escaped. And what's up with the fucking ads?
I got rid of the one on the side. I can't, I should have put a pop-up blocker on this browser, but I didn't, so they'd probably limit us from seeing the site if we put a pop-up blocker on it because a lot of sites do that.
Hmm.
I mean, I could switch my VPN over to a different
No, it's all
country.
right. Let's talk COVID. Uh,
so, so let's do this. Talk. What do you want to say, bro? Come on. Come at me.
do you think the numbers out of China are fake?
Yes, I do. I mean,
Why do you think so?
because there's just you're dealing with a very authoritarian government who's never told the truth before. Okay, so you have what happened before where the SARS outbreak happened there. And they didn't tell the world until it was too late. This guy from Hong Kong, I actually watched a really good documentary about this. This guy from Hong Kong went to China on business, was in his hotel room, and then went back to Hong Kong, and it spread like wildfire. Meanwhile, China, it was spreading like wildfire in China, and China never told anybody about it. And they just want to save face. That's their main game.
Yeah, I can kind of understand that. Um,
I mean, they
but
have the worst human rights violations on the planet, dude. Do you think these
no,
guys are
that's
gonna?
North Korea.
Okay, second. I'll give you North Korea, but China has one of the worst human rights records
You
on
also
the
have
planet.
Saudi Arabia.
But China, if this happened in Saudi Arabia, you think they'd come out and say, "Hey, by the way," or do
No,
you think that the
I'm not
king
sure.
of Saudi Arabia would be like, "Hey, dude, keep this under wraps. Just like even if in the United States, I mean, too many people would be reporting on it, but you're also seeing doctors coming forward saying that, hey, we're skewing the numbers over here.
Oh yeah, but it's like that in almost every country. Um, the WHO has clear guidelines on how to report COVID numbers. And sometimes they don't test people in nursery homes. Sometimes they write viral pneumonia on the death certificate
That's
instead of COVID.
that's exactly what's going on. And
Um,
China did the same thing, you know.
yeah, but if you do that, other countries will model their data based on that. And they'll be like, holy shit, we didn't expect this.
Yeah. I
Like
mean,
what happened in Italy.
well, that's what's going on because I mean, when you look at Italy and the contagion rate that happened in the United States, the ratios don't add up to China's numbers. Is my point. There's probably a lot more people dead from this in China and who have contracted it. I mean, the numbers just to me don't add up.
I've also heard that Iran has a lot of mass graves that you can see from space.
Sure.
Um,
And Iran is another authoritarian country that wants to save face. And, you know, here's the thing that's going on with them now, too, is we want to stop medical shipments. And that's wrong. You just, why? What would be the point of that? To see more people die? It's horrible.
yeah. Um, Also, what do you think about Sweden? They're, I think they're doing the herd immunity approach.
They
They're not
are,
closing down anything.
yeah, they are, but I think it's going to hit them really bad. I think it's going to be bad. I mean, you can't really do that with this virus. I could see the standard flu, where the seasonal flu herd immunity. I mean, because usually a lot of people
Yeah,
don't get flu shots.
yeah, and sometimes the flu shot isn't effective enough, and the flu spreads faster than you are able to vaccinate, and then the result will be herd immunity anyway.
Yeah, exactly. But this is a more dangerous virus than the flu is.
Yes,
So
it definitely is.
so that's why I don't think herd immunity. I mean, if you want herd immunity to work, you're looking at millions of dead people.
Yes, easily. And, millions sounds like a large number, but there are 7 billion people on the planet.
Right, but when you talk about that
And
in that aspect, it's okay, if you fight a
even
war,
0.1% is still millions of people, right?
yes. So if you fight a war and 20 million people get killed in that war, that's a lot of people still though. That's a lot
Yeah,
of humanity.
absolutely. Absolutely. I'm not saying it to downplay it. I'm just saying don't get caught up in low death rates, because when you compare that to an entire population, that's different,
Right.
you know?
Yeah, I mean there's a lot of people that are still kind of, well, it's like the flu. No, it's not. They don't understand the exponential curve of what's happening. So, do you want to talk about the exponential curve um, that's going on that you see with the graphs? Look at this
Um
graph.
uh, Gabriel Paravinci Paravi says Germany death rate is also insanely low compared to Italy. That's not true. They're actually catching up to Italy slowly. They just found their cases earlier.
Well,
Um,
let's bring up another thing here. So let's go to the main page on Worldometers. The site that we usually use for the numbers is Worldometers, and
yeah,
we're gonna take a look at the cases here.
I'll
So,
do some calculations while you're talking.
all right. So right now the USA has a half a million people. I'm sorry, yeah, half a million people that are being reported. So we don't know the actual number because there's still people out there that haven't been tested who could have had it and have transferred the disease to different people. So new cases, 32,313. Total deaths in the United States are at 18,637, with the new deaths today being at 1,946. Yesterday, which is a cool thing about this, you could compare from yesterday to today. So yesterday we only had 468,560. I shouldn't say only because it's a big number. Um, but the deaths yesterday was 1,900. Okay, but today now it's up, so we'll see what's going to happen here. I mean, I think since our population in the United States is kind of more condensed in the cities than a lot of other countries, we're going to be looking at some probably higher numbers.
Okay, so my theory about why the death rate in Italy is at 12% is because a lot of people haven't been tested. And the death rate in Germany at the moment, last stream we did, it was only 0.4%. Now it's 2.3%. So their death rate is actually climbing every day. So I think eventually it meets somewhere down in the middle at like 2% or 3%.
Right. Stargold had a question. Who comes up with all those stats anyways? Okay, so let me explain something about Worldometer. What they do is they get reports from hospitals, from the CDC, from even, I think sometimes even doctors will report on that site. So it's not just one entity that is reporting, it's multiple. It's a group based collective of people that is reporting all of these numbers.
Let me interject there. They also they update the numbers with the government numbers eventually. So at the end of the day, what Worldometers reports is the same as what the WHO gets. It's the same what John Hopkins has.
Yeah, I mean, and there's the John Hopkins map. I guess a lot of people like it because it looks really cool because it's all black and red, but it's a little crazy. I don't know. I don't think it's as accurate as the Worldometer site.
No, there's a huge lag time in the John Hopkins website,
Yeah.
at least a day or so. They have
Um.
been getting better lately, but you know.
So let's see. Chris Gomez, I don't know how to address that question. So this is the Anon news that one of the original anonymous hackers talked to about leaning more left and going off on people about needing help. Glad y'all changed y'all's tone, but this death rate is bad. I don't understand the question or the comment, I guess. I don't know. Any comments, Disco?
Not about that specific comment. There's also someone from Italy saying about Italy, I can tell you we are missing death rate counts, all the deaths that haven't been tested by a swab. Nursery homes had some insane increases in death rates, and that is not accounted in there. I can tell you it's the same in a lot of European countries.
Yes.
Um, so my government released a report today that there were at least 1,200 more deaths than normal during this week, and we only reported a few hundred deaths. Uh, I said 1,200, right?
Yes, I
Sorry.
think you did. Yeah.
So they also said that this is because of the coronavirus. They also calculated that for last influenza season, and this is way higher the death toll than a regular influenza virus. So that they came out with that report today and presented it to our government, and our government released it.
Yeah, okay. I didn't see that report, but it'd be interesting to see. Um, but Primitive is saying the Hill reported yesterday that COVID is killing more people in the U.S. per day than heart disease and cancer now. Yes, I've seen that report too. So it is pretty much the number one cause of death, I think, via being sick. I don't know about auto accidents and all that other stuff, but
Well, eventually this virus goes away. So, you know,
does it though? Because they're talking this could be a seasonal thing now.
yeah, but
So we could get into that because there is mutation occurring.
um, let me find a few statistics. So this year there were already like 3 million deaths from communicable diseases, and only 110,000 are from COVID, right? There
Right.
were deaths by hunger, deaths by cigarette smoking, deaths by AIDS, which is actually 41, no? 465,000 AIDS deaths this year already.
Right. So then the problem with that is there is stuff that minimizes HIV and AIDS so that it's really not a problem. The problem is these companies don't want to give people the means to the end of that because you can get AIDS and HIV down to where it's non-transmittable. It's not even detectable in you. But the problem is these drug companies are charging insane amounts of money.
It's true.
So I mean, so they continue the disease.
But like we're seeing, the flattening of the curve is happening because people are social distancing.
Well, see, I'm not going to make that claim yet because I think it's just too early. I really do. Unless you have a couple weeks worth of data to
I already
analyze.
have a couple of weeks worth of data that shows this. We'd be in the tens of millions by now if it didn't slow down
Well, it is slowing down
significantly. Yeah,
via social distancing, but I don't think that we're at the curve yet. You know what I mean? I don't think we're going to see because like I told you before, this is before we went live. We still have to understand that Africa and India um, probably aren't going to have the means to report and test all of the deaths that they're going to experience because of this. And a lot of the countries are third world countries over there, and India has billions, or a billion people.
yeah, and I also heard, you know, in Ecuador. Let me check. They have reported 297 deaths in total, but I've heard the situation there is apocalyptic. That people are freaking out. And I've also seen hospitals being overwhelmed there with lots and lots and lots of people on ventilators.
Right. So, I mean, that's the problem is when you hit these third world countries, it becomes apocalyptic, but you don't know scientifically where. I mean, you know that they're getting the virus, but you don't know it scientifically because they don't have the testing capability.
Exactly.
Just like in Nigeria, there's 17 new cases. So that means there's only 17 people, new cases, 17 new people were tested. It doesn't mean that it's just 17 new cases. There's probably 20 times that. They just don't have the testing
That greatly
capability.
reduces the death ratio, though.
It does, which is a good thing
Yeah.
in some aspects of it.
No, it is a good thing.
In some
Period.
aspects of it, because here's the thing: is you to see the enemy, you have to.
Test all the cases.
Exactly. So,
Yeah.
I mean, right now people are fighting blind. Like, somebody online I was arguing with about this was like, we don't need testing, and I'm like, so you're gonna fight an enemy blind? And my thing is, test everybody that can be tested. If they don't want to be tested, then they should sit in quarantine. Does that sound draconian? Sure, it does. But you know what? We're fighting an enemy that's um,
Invisible.
invisible.
Yeah. The most draconian measures were taken in China. And I do think they were able to slow down their curve in that sense. Or else they wouldn't open up Wuhan
Right.
like they did.
Well, yeah. I mean, well, D-Rod says, well, when is China going to stop lying about their numbers? Well, here's the thing about China. They're never going to stop lying about their numbers because they're not a free society, so they don't have to. Just like America's United States is lying about our numbers because they're slapping pneumonia on half the people that they see. There was a doctor that reported he was reporting 3 deaths in a county, and this was in an article I read. He called up the CDC to report those deaths, and the CDC only reported one of those deaths out of those 3 people, and all 3 people were COVID-19. So it's not just China that's doing it.
No. And like we said, a lot of countries don't have the testing capability. So a lot of countries are doing it, but not on purpose.
Right. Now, Black Dream Hunk 2 brought up Black Americans are affected in the US. Black Dream Hunk, what's up? Uh, the thing is, I'm laughing at your name, dude, because it's just like it's very, I don't know, it's a
It's
good,
funny.
it's funny.
It's a good name.
All right, so let's talk about the inequality. So there are poor neighborhoods that probably do not get the same type of care as um, middle class or upper middle class neighborhoods do. So absolutely, there is a lot going on with that, and it's unfortunate. And things need to change for the better. We can see that the virus doesn't care what color you are. What's happening is it's attacking. It'll attack probably poor communities first because they don't have the means, um,
They
such as
can't afford it
healthcare.
to
Exactly.
they also can't afford it to social distance. They have to move within the community. They have to use the buses and the
They
trains.
have to go to work.
They can't afford to stay home.
Yeah, they have to go to work, and just like when people are trying to sit at home, they don't realize that there's 78% of Americans just in this country that are living paycheck to paycheck, and if they lose one of those paychecks, they're going to be homeless.
And it could also be that the color of your skin determines your vitamin D intake. That could also be a correlation.
It could be a correlation, but you know what? Um, there's a lot of it varies. I mean, it's I could get your point if it was varying by um the ethnicity, but it doesn't.
What do you mean varying by the ethnicity? Because
So black, white,
I
China.
can show you reports that it does.
Okay, so show me the report that it does. I'd like the link to that because
I-
uh,
I'll show you tomorrow, and we'll talk about it later.
all right, because I've seen people who have brown skin and people who have white skin, and we in the United States is predominantly Caucasian. So why do we have the most numbers if it's affecting skin color? Are you saying that it affects white people more than other people?
You're not getting my point.
Look at you get mad. Rage.
But no, I want to be very careful here because treating we're threading in territory that
And
I'm not comfortable
I'm not
talking about.
comfortable with talking about it either, but the point has been brought up in the United States that there are a lot more black people dying from this than white people, and this is
And that's true in the
it is
statistics, but it has.
absolutely.
So you're not denying it.
No, I'm not
Um,
denying it. It's absolutely happening because these people have to go to work. They have to pay their bills, and they're being forced to do something that they shouldn't have to do because of their economic status, and it's wrong.
yeah, it is wrong.
So we agree, but we
Yeah,
argue.
but I also think it has to do with vitamin D intake.
I don't know. I am unfamiliar with it, so I really can't argue with that point.
Yeah, I'll show you the.
Okay, so
I'll show you what I'm talking about. It's a YouTube video where a doctor explains this.
all right, Black Dream Hunk 2 says Google virus is twice as deadly for black and Latino people than whites in New York City.
Yeah,
So I mean, I would think it would be because of the economics of it, but if it's a
yeah.
vitamin D deficiency, then we'll have to look into that too.
I think it's a combination of all those things, and also poorer people don't have access to private healthcare, and most of them are not insured, so they'll be more likely to die from this. Sadly,
Right. No, I mean it's but you have poor income people in China too, which I think that I mean we can't really talk about China's numbers because I don't trust China's numbers. I mean, we could talk about the United States' numbers; they're a little bit more reliable, but are they really? I mean, I don't know. I mean, they're a
I
little
think
bit
I
more forward with them, sure.
and I think New York has accurate reporting.
Yeah, it does. So I'm looking at the linear data of total deaths, which is at it's still going up. Hasn't been reported for the 10th yet, but it's at 95,693. And the chart next to it is the total cases in.
You're looking at yesterday, by the way.
Am I really? Hold on.
Yes.
Oh, yeah, thank you. Noob. Actually, it's the same because that was only I'm looking at the charts. The charts didn't have the yesterday
Oh, okay.
statistics in it. So
I
you're
was looking at a different screen. I'm sorry.
oh you're on a lag. I
Yes.
apologize for that. But yeah, what you guys are saying is probably like 5 to 10 seconds after I am talking, or maybe even more. I don't know why YouTube does that, but they do. So we're looking at active cases, closed cases, and it's shocking, isn't it? That
Yeah.
if you look at the total number of active cases versus closed cases total, that's
I
crazy, horrendous.
I think there's also misreporting about how many people are discharged.
There has to be because if these are the actual numbers, dude, that's not good.
No, not good at all.
This means how many months have some of these people had this? You're talking
Yeah.
months, dude, not just 1 or 2 months. I mean, and
Well,
you
China has almost closed all of their cases.
oh, according to them. So
Yeah.
yeah, sure.
If you go to scroll down to China, let me
I'm
see.
scrolling down to China as we speak. All right, so I'll
They have only 1,000 active cases, of which 144 critical. That used to be a lot more.
So what do they have that no one else does?
Time. It started there. There, everyone else is way behind.
Hmm.
Does that make sense?
No, no, no. It totally makes sense. I'm just thinking about it. I'm doing computations in my head, and um, I'm wondering because you've seen influxes within the past month or two where you'll see China come out and say, "Okay, 77 people died this day," and then all of a sudden nothing, and then their curves are. Let me click on China. Let's look at their curves. Their curves. What's up? That's right, we're crazy people. So, all right. So, to, oh god, total coronavirus cases in China. All right, so we're looking at the linear graph here. All right, and it's leveled out. It's it's there. Now let's look at the logarithmic, and it's flatlined. All right,
Yep.
so and on April 7th, there's I don't know, man. Daily cases 62 on April 7th. On the 3rd, I can't even, there's nothing. There's on March 31st, 36 cases. So, yeah, they passed the curve in February 17th.
Yeah. I think if you do enough mitigation, you can get there because once you quarantine all the people who are infected, the virus will burn itself out. Do you understand that? Is
Absolutely.
is that a good explanation?
It will, but here's the thing is what I think most people want to do is save as many lives as possible.
Absolutely.
So, I mean, we could burn the virus out by doing what Finland's doing, sure. But you know how many people are going to die?
No, I'm saying if you isolate every case, you can let the virus burn itself out inside those people who are isolated, and they're isolated so they can't spread it. So I guess it didn't make sense what I was saying.
No, it did make sense, but I'm talking
I'm
from a
not
different
talking about the herd
perspective.
immunity. I'm not talking about the herd immunity idea.
Okay.
When a virus burns out, it means it doesn't spread anymore.
You seem angry today.
I'm not angry.
All right. So, the daily deaths in China is at is at like one like on the 9th yesterday. So we're good. So I mean, I don't know, maybe you're right with the China thing.
They welded people shut in their homes to contain the virus.
They did.
I mean, no other country would take such measures because it's horrible. The earwax commercial.
Where's that? Oh, no, I missed it. Damn it. I missed the earwax commercial.
Uh,
So right now we are going to probably be beating Italy very shortly with total deaths, but we also have a larger population, and there's so many different things to account for um, in that. So when let me just also point out that since we are on a lag and since we do sometimes see your questions and we answer them, it's because of that lag that we're answering them in a later fashion than we do. I mean, if this was real time, we'd probably be like, "Hey, blah blah blah," as soon as you typed it. But we're not. It's not real time. There's definite lag going on for streaming purposes. So
yeah.
So what would you like to say? Anything else? Anything else you'd like to address? Any questions?
Any questions from the audience, you mean?
Well, what about you? Do you have any like anything you'd want to address further on what we're talking about?
Um, I, I am cautiously optimistic that the rate of spread is slowing down in a lot of countries, including the UK, including Italy, including France and Spain, the Netherlands, and in New York City. The spread is slowing down. Now, this doesn't mean that the spread of the virus is slowing down entirely, because other countries will get infected, and we're seeing in Ecuador that it's going straight up. It's shooting up in the sky. Same with Brazil.
Well, let's go back to look at Ecuador really quick. Oh, that's gross. The earwax commercial. I just seen it. That's disgusting, dude. All right, Ecuador. Okay, so let's look at their graph. Holy, yeah, absolutely. It's skyrocketing.
Yeah,
Let's
and you,
see.
you don't realize it yet, but this will double and double and double and double and double, and that's where you get the hockey stick graph from.
Right,
That's
and
what they call it, right?
yes, and the stepping method that we've discussed too, where it's always like step up, step down, step down, step up, step up, step down. So I mean, we're seeing that kind of. It's a little bit different in Ecuador. I'm looking at with the they started reporting their cases. It looks like their first case was on February 21st, and it almost seems like they kept it under some kind of control, or it was just underreported.
Yeah. So that one person infected a lot of others, because one person gives it to two people, those two people give it to four, those four give it to
Well, we
eight.
don't know that because there was an article that was actually written by, I think, a Chicago Tribune author, and he got the coronavirus. And what he did is he did contact tracing, and it turns out that he infected 16 people with it.
Oh yeah, and there's reports of one person infecting 100 people and that kind of stuff, but I'm talking on average. And for example, in the UK it's now zero point 0.3, so the virus is slowly dying down there, but it's going to take a long, 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 long time before it dies down there, because they have a lot of cases. Um, where was I going with this?
I don't know. You tell me.
So that.
So yeah. Anyways, anybody have any questions? So let's see. Black Dream Hunk 2 said, "What are your thoughts on the Japanese numbers?" I think Japan's telling the truth. I think that they I know they live in a very stringent society where they will follow the rules. I mean,
I think initially they didn't, um, because of the Olympic Games that were going to be held there, but they had to cancel them anyway.
yeah, which of course they had to have.
And since they announced that, the cases went up and the deaths went up.
Yep. Nocturnal Valkyrie had a question. Let's see. Where did she say? I'm scrolling back to see your question. How much damage in the meantime? I'm not sure. Ask your question again, Nocturnal Valkyrie.
Anyway, there was something else I wanted to add, but I have to search for a news article first.
Okay, go ahead. Yeah, I'll.
So continue talking in the meantime.
Thanks. Thank you, bro. What we're seeing, I think, on a global scale is maybe it is kind of slowing down a little bit, but I want to be cautious about that too because I don't want to give anybody false hope. either, because this is something that we in our lifetimes have really never dealt with on such a large scale. So I don't know. Let's see. Say Nocturnal Valkyrie is saying, say the whole thing is a prank. This is on a global scale. Yeah, it's not a prank. It's happening. I've known people. I know people who are affected by it. So in real life, personally. So yeah, it's happening. Um, but yeah, guys, we are, just
So
as.
I have this news article from December 31st. Um,
Let me bring it up just a minute. I gotta get.
where the first cases of coronavirus were reported. It says there are 27 patients, of which 7 are critically ill. So we've known about this for a very, very, very long time, and we've been talking about this since January. Um,
Well, a lot of people are saying that maybe this has been around for longer than they think, because people have been getting sick, and maybe it's just, I mean, I don't know. It's speculation at this point. They're going to need to do some tracing on it.
yeah. Um, all those 27 cases that were reported in the beginning had connection to the Wuhan seafood market. So that's where the official story comes from,
Sure.
you know? Um, but yeah, this cluster and then the response China had to it, wearing full hazmat suits, building new hospitals, disinfecting the streets. I mean, that's enough to tell you that this is serious.
It's definitely a serious issue that people need to protect themselves from. Uh, I mean, I've been saying from the beginning to mask up, but the CDC here in my country was against that for the sole purpose of getting the doctors masks. But my argument to getting the doctors masks is you wouldn't have needed so many masks if the population was masked up, because it would have stopped a lot of the spread.
Okay, so someone in the comments just said the Spanish flu killed more people during its second wave. What's
Yes.
your theory on a second wave of the coronavirus? Because waves happen because of seasonality, and we're not seeing seasonality here.
Um, well, that necessarily isn't true, and I will argue the point that the virus can live in 97 degrees Fahrenheit for 3 to 4 days, but it can live weeks when it's cold out, weeks out in the open when it's cold. So it's more contractible when it's colder out, absolutely, but it's contractible still when it's warmer, but it doesn't live as long.
Yeah, okay, that's my theory as well. Because I also think that that's why we're seeing a little slowdown of the spread at the moment. Also because of all the social distancing measures. Without it, I think cases would have gone through the roof.
Right.
There's a reason countries are destroying their economies by social distancing. It's because they don't want the bodies to stack up on the sidewalks.
And that probably would definitely be happening. Primitive says he hasn't seen anyone where he lives wearing masks. I see
And
about where I live. I see about, I don't know, 1/3 of the people at a store wearing masks. I mean, I go in with a P100 respirator, so I'm not playing around, because if I get it, guess who's gonna die? Me.
yeah, because you're a vulnerable person. Um,
Uh
in my country, the health service is saying you should not wear mask because it can increase infections.
Wrong.
They say you will adjust the mask, you will wear it wrong, and you'll constantly be touching your face.
Well, that's why
So
they need. That's why they need to train people how to do this stuff. That's just a moronic statement. All right, go
I
ahead.
know.
I'm sorry. Go ahead.
I I think the underlying reason for this is because they're out of stock
Absolutely.
and they need it for the healthcare
But
workers.
then don't throw people under the bus and tell them, hey, just like in the United States, they're just like, guess what? Hey, you don't need to wear a mask because you don't know what the hell you're doing anyways, and we need them for the medical professionals. You know what? Let the people wear masks. Teach them how to wear them. Do negative pressure tests. Teach them how to do negative pressure tests on P100 masks and N95 masks. It's not that hard. Really isn't.
No, and actually, I do have my own mask, but I never wear it because no one around me is wearing the mask and they'll look at me funny.
Herd
I'm very
mentality.
susceptible to that stuff.
Herd mentality. I'm just kidding, dude. Here's the thing, dude, is you need to protect yourself. This is a time of um it's not every man for himself, man, woman, and child for themselves. You
I'll
just
just stick to the social distancing and keeping a 2 meters distance from everyone, like the government is telling us to
but
do.
you can't.
You can, because everyone has to do it, or you'll get arrested.
So I'll bring this off air about where you work, but you can't where you work, but that's the
Yeah.
thing.
So what people have to do, they have to take a shopping cart with them. Everyone who comes in, and the amount of shopping carts counts the amount of people who are in the store. So not only do the shopping carts create distance between the people, it also allows us to count how many people there are in the store.
Well, that's you know what, that's weird because it's going on here. So like where I live, you go to the store and they have the shopping carts outside and they're spraying them down and wiping them down,
Yeah,
and there's only a certain amount of people allowed in the store at the same time.
exactly.
So I hear you.
So it is possible to do the social distancing inside a store.
Yes. So yeah, I mean, so we've been on for 57 minutes. You guys have any questions for us before we end the live stream?
Criticism is also good.
Yeah, just don't be too hard because we do have feelings. We're just not some keyboard warriors that have
What are
no
you talking
have
about?
no feelings. We have feelings, Disco.
I don't.
See, this is all because you wouldn't let me vape. See, so my brain starts coming up with crazy things, and that's okay. Oh, we're losing people viewer. All right, so I guess there's no questions. I guess we've answered everybody's questions, and um, we're good to go. So
All
hey,
right.
we thank everyone for listening, tuning in. We
Next
were
time we'll do a more organized stream where we have the topics laid out for us and already have all the tabs open that we need.
well, that's the thing is we kind of sometimes don't do that. And the last show we did was more organized because we sat down and said, oh, "What are we going to talk about?" And we had a list of things and we had the tabs and um,
And this time you just said whatever you want to talk about, I'll listen and react.
yeah, and I am. I mean, I'm sitting back, listening and reacting. And uh, Black Dream Hunk 2 has been called a keyboard warrior.
Yeah,
Look at my two
that's
questions.
too.
And Daz, oh my god, I can't pronounce. And Dazi is saying, look at my two questions. Okay, let me. So the one guy is from Germany who told the mask story about his country. No, he's not from Germany. So no.
Why the American company which produced the medicine remdesivir stopped selling the medicine after German scientists started
Oh,
research with it and said it's a good medicine for COVID-19. Mm, I don't know. I think all clinical trials are just that, trials,
But if you
to
look
see
at
if it
Germany,
works.
here's a good point, dude. Look at what Germany actually is turning around. That's a good point. And there's reports that Germany is really turning around.
Last week when we did the
Wow,
stream, their
they
death
are.
rate. Last week when we did the stream, their death rate was at 0.4%. Now it's at 2.3%.
Yeah, so they're turning it. They're
No, you're not listening. zero point 0.4 to
Oh,
2.3%.
okay. I didn't hear you. I thought you said something else. My bad. Relax. Deep breaths. No, don't get mad. So if you look at the active cases, they're in decline.
Yes, like everywhere.
Right. So I don't know if it's the drug that they're using
No, it's the social distancing.
or if it's the
Um,
social distancing.
you can't stop cases by using drugs because first the cases come in and then you treat the cases.
It seems like their new recoveries are on the decline and their new cases are kind of leveling off. So,
Look at the deaths. That's what the drug is trying to prevent, not the cases.
right, the death rate is at 4.74%. The recovery
Well,
rate,
when you,
the recovery rate is at 95.26%.
at the moment,
At the
I
moment,
mean,
if you look at the outcome of total closed cases and the recovery rate versus death rate, the cumulative total deaths and recoveries over cumulative numbers of closed cases, that's what it is coming out to be.
but
That
what
was
I
a
was
mouthful,
explaining,
dude.
yeah, what I was explaining last week, they had a 0.4% case fatality rate, all active cases compared to all deaths, and that is now 2.3%. So they're being hit hard. They just found the cases early. They're not turning this around. Yes, in terms of social distancing, the new cases are declining, but you can't decline new cases with a drug. You can decline deaths with a drug, but not new cases.
No. You mistook exactly. No, I never said that. I never said that they could stop new cases with the drug. That's what I'm talking about. I'm talking about the case fatality rate, dude. I'm not talking about new cases
Oh,
being
that always converges around 2.3% for every country,
right. No, you totally
regardless
mistook
of
what
what
I
they're
was
doing.
talking about. I not totally not talking about stopping new cases with a drug. No, people that's pre- that's there's no preventative for this except social distancing.
Yes.
So yeah, I mean that's pretty much it. Virus is related to gluten intake. Well, I mean, I don't know about that.
Um,
Gabrielle Pavare. I'm sorry. I'm gonna butcher your last name.
we
Paravin.
need some evidence for that.
Yeah, we need evidence for that. And I know you're probably in Italy, and there's a lot of stuff going on that you're hearing back and forth. But we're trying to stay as scientific as we possibly can because we actually got suspended for being scientific on Twitter. We were banned for a little bit, and we don't want that to happen. So we wrote Twitter and talked to them about what happened, and suddenly now they're allowing us to report on it again. And um, yeah, that's that.
Yeah, Twitter totally censored us. No idea why.
Well, because we were talking about the virus and we were actually giving really good information out. Like when maybe they got pissed because, we were saying, you know what, you should wear a mask. I don't care what your government's saying. Wear a damn mask. And the powers that be or whatever, I mean, since we do have an okay following, was these guys have too big of a voice, shut them down.
But now the WHO even said wear masks.
Well, now the CDC is even saying wear masks,
Yeah.
but they threw the people under the bus before they. I mean, they shouldn't have ever done that. They should have said, "Hey, here's the deal. Let's have get as many masks you can, and if you can't wear a mask, wear something over your face so you're not spreading the virus if you have it." But they didn't. They totally dismissed it, and
Yeah.
that was wrong.
Absolutely.
So I'm done with my rant. My rage is coming. I can't vape. uh,
And let's end it right there.
we will. I just want to make sure that you guys understand that yes, we're being humorous in these times because we don't think that being sad and everything else will solve any problems. So apologize our humor. Sometimes we're going to be acting a little crazy here and there, which is fine, and people should let go. Um, so Prim,
You don't need to explain yourself.
exactly. Prim says that Twitter keeps locking him for no reason. It happened to me the other day, and they what do you call it? They
The,
suspended my old account that I never use, and I've never tweeted on it out of it for like 2 months. So I was like, "What the hell just happened?" So it was weird. I tried to get it back, but they've never responded back to me about it.
and yesterday they locked us out again, but that was fixed instantly.
Yeah, they keep locking us out of the YourAnonNews account. It's constant, and whoever's attached to the YourAnonNews account is also getting locked out of their own accounts, and they have to
That's true.
re-verify.
I'm not necessarily sure that the two are related. Maybe a lot more people are getting locked out of their account, and it's just
I think it's related, dude.
okay.
I mean, I don't know. It's happened to me twice, and each time it's because your non news was you had to re-verify. So
All right.
on my personal your anon 2 world account, I had to re-verify. So we're technically not anonymous anymore,
No,
but everybody knows that the movement's kind of.
don't go there.
We're anonymous, damn it. All right, hey, so you guys take it easy. We love you guys. Um, I know it's been a kind of a wacky show. We're
Yeah,
we're
I'm
shooting from the
tired of
hip, Disco.
shit. Yeah,
We're shooting from the hip. This is not probably one of our better shows, but it's informative to say the least.
it's very true. And I apologize. I'm also a little bit tired today because I'm an essential worker, and so is Anon's World. So
Yes. You guys have a great Friday. Have a happy
Easter,
Easter if you celebrate that or whatever tradition you celebrate. Have a
but
happy.
stay at home.
Yes, I am Bill Gardner, primitive. I was doxxed as Bill Gardner.
You are Bill Gartner. Anyway,
Isn't he a spam
happy
king?
happy Easter, everyone, but stay home.
Does everybody see what I'm trying to do to Disco? I'm trying to keep him going, trying to keep him on the live stream so we can have some fun.
Stay home and take care. Be healthy, be safe.
I almost choked. I was trying to drink and I almost spit it all over my monitor. Oh. Okay, hey guys, we love you. Be safe. I'm ending the stream now. We're going to commercial break. We'll be right back. No, we won't.
No, we won't be.
We were not being. If you buy this for 1995. All right, guys, that's it. We're done. Peace.